Hi, good afternoon, everyone. This is Congressman Jeff Fortenberry. I'm calling to your homes today to do a live telephone town hall meeting. I really appreciate you taking a little bit of time to join me today. The purpose of today's call is the coronavirus and to give you an update on what your government's response is. But I do want to spend the bulk of the call taking your phone calls with questions or any ideas or any other considerations that you think I might need to know. Again, this is Congressman Jeff Fortenberry with you today for a live telephone town hall, and I look forward to your questions. If you need to ask me a question, you press 0 on your phone, and then we'll get you in a queue and try to get as many as possible. I'm going to be joined on the line today in a little bit by an expert from the Food and Drug Administration. I do have an expert from the Small Business Administration on the line as well. And the committee that I serve on is the House Appropriations Committee. We will have a key role in writing the next portion of the federal response. I have one of the key members of that staff on the line as well. I've also been joined by a leader in our local community here in Lincoln who runs a major social service agency. So I may turn to them during the phone call with any specific questions, but just so you know, we have some experts on standby. But the first thing I wanted to do is give you an overview of the response by your federal government. I think it is pretty clear to most Americans by now that this is a major emergency. Obviously, Nebraskans are doing a tremendous job of not only remaining calm, but taking care of families and primary responsibilities. This is an international pandemic that has spread to our country. The first response of our government was to protect health. Congress came quickly together on a bipartisan initiative to move significant resources toward both the testing for the disease as well as treatment and long-term planning, including vaccine development. As we see more testing become available, particularly this week and in the next week, we're going to see a spike in the increases of the incidence of disease. I'm hopeful that this policy, combined with social distancing and the closure of major gatherings, is actually going to help us do something called flatten the curve. And what that means is reduce the incidence of the spread of the disease so that the medical response can be appropriately managed. We've done some important things internationally, closing travel from China, closing certain travel from Europe. Today, the border is being closed to illegal migration from even persons who have come here illegally, would not be let in the country, but they would be detained. They're being turned back. This is all part of the necessity to protect your health. The second thing that's happened at the federal level was an initial response to the economic conditions. What that bill does is it helps small businesses who have employees that may have gotten sick to provide for paid sick leave. It does some other things, such as provide the start to some small business loans to help get us through. But it quickly became apparent that the negative economic multipliers of this problem, particularly as it hit the hospitality, restaurant, food service, travel industry so hard, is causing very significant negative shrinkage in the economy. Many of you may have already been impacted by this. And so Congress is coming together as we speak to put together a third package that will provide direct assistance, cash basically to families who are in need, cash direct assistance to small businesses through loan programs that can be forgiven to businesses who retain their employees, and then some other helps to the larger sectors that have been so impacted by this. Let's be clear, this is not a bailout to big business. There will be some help to large industrial sectors who have been devastated by this, but the primary response here is to try to move government assistance to many of you directly so that you have the ability to pay bills and to help small business stay in business. And that's the key to helping us all get through this quickly. So with that said, again, I'm so grateful for your willingness to spend a little time with me today. Again, this is Congressman Jeff Fortenberry. I want to keep the focus solely today on the coronavirus epidemic, your needs, your response, and then how I can personally help you. I'm sorry for the suffering that's gone on out there. So many of you are dealing with things that we couldn't have imagined just 3 weeks ago. But there is an attempt at the federal government, again, to create the conditions in which we are protecting your health and then protecting economic well-being so that we can create a bridge to get through this as a nation. Frankly, it's my hope that once we are past this and past this successfully, we'll all look back upon this time as one of national solidarity in which we all did things that, yes, were sacrificial, but we made it through. But we've got a ways to go yet. So let's now go to questions. I am going to take a call from Mark. Hi, Mark, are you on the line? Hi, Mark. You there?
Carla, actually. Yes.
Hi, go ahead, yes.
Yes, I'm here. So I hear that testing is of paramount importance, but I live here in Lincoln, and I'm hearing that there's 360 tests between the two Bryan hospitals, and none of them have been used. And we have kids coming back from spring break who have been in Colorado where there are known cases. And so I'm just kind of wondering, how does that work?
It's a fair question. I do not know the specifics to your question regarding the number of tests that are available at Bryan or if they're being held up. We have had a testing problem in the sense that there weren't enough test kits available across the country. However, that question, that's being remedied quickly. I do not have specifics, though, as to what the local situation is. What the general protocol is, if someone has some basic symptoms of coronavirus, which fundamentally are shortness of breath and a fever, they're going to be prioritized. Myself, I got sick last week and actually was the first one to go through the protocol at a local clinic. We tested first for the flu, strep, and then the respiratory illness, and it came back for the respiratory illness. So we did not take the further step to coronavirus. That's still the basic protocol that is happening. So why don't you stay on the line for a little while longer? I'm going to have someone from the FDA get on shortly, and maybe I'll ask them to give us an update just on the national situation on the testing distribution. If any of you are encountering you're welcome. If any of you are encountering some problem with a particular type of supply, though, I'd like to hear it. But thank you very much. It's a good question. If you'll stay on the line, maybe we can have more information on that. Thank you very much. Let's now go to, hi, Abby. Abby, are you on the line?
Yes, thank you. Can you hear me?
Yes. Yes, go ahead.
Thank you. You spoke about the relief packages and that the relief would be primarily to small businesses. Just this afternoon, President Trump indicated that he would demand that there be no stock buyback. Would you join that demand, and would you also demand that large corporations be first required to look at borrowing at these rock-bottom interest rates against using their equipment and those sorts of things as collateral before they're able to receive federal bailout funds?
Abby, these are outstanding questions. I was not able to see the fullness of the President's press conference. I listened to a portion of it on radio. I am inclined toward the basic disposition of the President's. This is not a bailout for large corporations who already have significant means at their disposal. There will be certain subsidies for certain industrial sectors, but I want to keep the emphasis on moving help to individuals and families who need to just pay bills, and secondly, to help small businesses stay in business with the industrial sector's help that's going to be necessary. But this is no big business bailout. Look, I lived through the financial crisis. I voted against that and the bailouts earlier because I thought that it was too top-heavy. However, this time I think there's appropriate sensitivity to the questions that you're asking regarding perhaps even limitation on executive pay so that they can't use your investment, which is a taxpayer investment, to enrich large corporations who do not necessarily need the help. So the question about stock buyback and executive pay are going to be considered by the House shortly, and I appreciate your input. It's very helpful to know. In terms of sentiment, that is my direct sentiment. I want to see how we work through this in the House, but I'm glad the President raised it, and again, in sentiment, I am with him in spirit that this is not going to be some sort of taxpayer subsidy to larger businesses. Thank you very much. Let's now go to, hi, Janelle, you there?
Hello?
Yes, hi, Janelle. Hi.
Yes, hi. I have a question. What about people who are independent contractors or people who are self-employed? how are they going to be helped?
It's a great question, Janelle. I'm trying to find the answer out at the moment. I suspect that, again, this is a suspicion, and we actually need to move this into consideration in the House if the Senate hasn't already taken care of it. I suspect that there will be a desire to treat individuals and contractors similarly to small businesses. Now, I have a representative of the Small Business Administration on the line. Leon, do you have any insight into that question at the moment?
Yes, yes, I do. Matter of fact, what you just explained to her, we are treating them as small business owners. They can apply for the EIDL loan, and that is one of the things that we set up that they can do. You know, they just have to use their tax ID number and do the estimate of loss in terms of revenue. So that is one of the things that has been discussed already, and we've championed that too in all of our discussions. Thank you.
A very good answer. Thank you so much, Leon. Does that help you, Janelle?
Yeah, I do have one more question, though.
Yes.
On the last town hall that I was able to get into, there was a caller who suggested that this coronavirus was biological warfare by the Democrats, and you didn't do anything to say that was not true. So I'm wondering,
Janelle, that was me. That was me. Listen, I'm trying to contain these town hall meetings to just the question of coronavirus and such. I went on and talked about in that call about the possibility of bioterrorism and how this is a real threat to our national security. I don't want to shame anybody on a call or get in a disagreement about things like that. It was just a person's general commentary, and I let them speak. The bigger issue, though, is that we want to actually be very aware that the issue of bioterrorism is one that is real, and it's been real for a long time. There's been some consideration of that quietly in Washington. The primary understanding of where the virus came from is from an animal to human transfer and some sort of biological mutation. It was not helpful, and it's still not helpful, that the Chinese have not shared the basic molecular information from the origins of the disease. And so it's easy for people to wonder whether or not this actually was some act of potential bioterrorism. Now, again, I think it's unlikely. Obviously, the Chinese were very significantly impacted by this, and they have been severely disrupted themselves by the nature of the disease. But what I want to try to avoid is any general broad political commentary or shaming people for their perspective. That's why I just wanted to give an objective answer about the nature of what we have to do in the 21st century about this. Okay? So thank you for your understanding. Let's now go to William Stone. Hi, William. You on the line?
Hi. Yes, I am. Hi, Congressman. Thanks for taking my question. So, listen, it seems to me that looking around, just as businesses driving around Lincoln, that this is clearly driving us into probably a recession and potentially even depression. It seems to me the easiest, fastest way to deal with this in terms of financial issues is simply a 100% tax refund on anything, all federal taxes for fiscal year 2019, and then a complete moratorium on taxation at the federal level for the next year or two. Why don't we consider something like that? Simply refund everything that anybody's paid in so far this year, and then no more taxes for the next couple, as a real easy stimulus to do.
William, thank you for the suggestion. I appreciate that. As you know, given the nature of the urgency here, there were 3 attempts to move legislation. We're in the midst of the third one. We've gotten 2 done. The initial was a healthcare response. The second was a small business response based upon the thinking that people who get sick aren't going to be able to come to work and they need help, so we're going to pay for their sick leave. But quickly, the nature of the economic negative multipliers has become so apparent that there is an attempt to put together a bill. Now, let me just open myself up to just a little bit of policy debate with you and dialogue. Your question is well considered. Okay, hi, this is Congressman Fortenberry. I apologize for the technical difficulty that we have. I believe I am now on the line. Can everyone hear me? Yes, thank you. Okay, I was trying to get Sophie's question. I don't know if I'm going to be able to get to it.
This is Sophie.
Okay, I'm sorry. Go ahead.
Quick question for you.
Yes.
Information about this virus all on the same day. Within a week, South Korea was testing 15,000 people a day. Our nation is vast. We have more resources in South Korea, and we're still not testing that many people a day. Will you investigate where the problem was? Because this is what, about 4 or 5 weeks later, and we're still not where South Korea was within a week. And to me, it's a scary situation because this could happen again. So
okay, great.
Hopefully you will investigate this issue, in your capacity with the House and find out who dropped the ball at the federal government level. Thank you.
Okay, well, thank you for the question. I appreciate that. I am going to be joined by someone from the Food and Drug Administration, an expert. Actually, I have been in contact with the lead commissioner, Dr. Hahn. I spoke with him yesterday about the movement of supplies. If any of you have a supply question, I'd like you to contact me directly so that we can get you help if need be. If you have a question, press 0 on your phone, or if you can't stay on the line and you need to leave me a message, go ahead and press 1, and I will review those and get back to you. That's a fair question. I want to leave the unpacking to what went right, what went wrong to a little bit later. But I am what's called the ranking member of the Appropriations Subcommittee on Agriculture with responsibilities over the Food and Drug Administration. There's another issue here related to the problem of supply management. A significant portion of our drugs and our supplies and our drug input ingredients come from China. It's a huge problem. I've been sounding the alarm for this long before this pandemic, but these things need to be made in America, period. There has been some legislation proposed at the national level. If I was an industry leader in the pharmaceutical industry, I'd be on notice right quick that you need to be starting to make some different kinds of business arrangements rather than the kind that you've done in past, because there's going to be intense scrutiny over this. We cannot adequately inspect the integrity of drugs coming from overseas. That's been a problem for a long time. From my perspective, this needs to be made in America, and that's going to be one of my pushes in Congress. So thank you very much. Let's now go to Francis. Are you on the line?
I'm here. This is Frank. Congressman?
Hey, Mike. Yes, sir. Go ahead.
Yes, I want to thank you for taking my questions and let you know that your staff is very good. They've been very helpful to me in the past. Anyway, my question is that on the stimulus check that's going to be coming out, and I hear that it's going to be based on the 2018 income tax returns. And my issue is that I didn't file any 2018 income tax return, nor was I planning to file a 2019 because I don't make enough income.
It's a great question, Francis, and this is part of the problem that the bill is hung up in the Senate. For people who do not have any income or are of lower income, just having a tax liability as the measure by which you would get a potential subsidy, in my view, is wrong. We're trying to actually move money quickly to people who are in need. Now, one way to do it, obviously, is those who have had tax liability, and that gives us a fair gauge as to who are basically lower and middle class income people who need the money the most. This idea, though, or this consideration is front and center, I assure you, in the debate that's going on in the Senate right now, and it will be in the House. We need to make this fair for people like you. So I really appreciate you raising it. It's one of the things that I'll flag and will communicate back to the House of Representatives as this bill is being negotiated. Does that sound fair, Mike?
Congressman, what I am going to do, though, is I am going to submit a 2018 and 2019 return with still life.
Well, I think that's smart. By the way, as of yesterday, tax payments were deferred for 3 months. Now I learned today from the Treasury Secretary that tax filings are also going to be delayed for months. So there's no pressure to pay the taxes or to actually file. So there's going to be extensions on all of that. So I hope that helps you as well. So great question.
All right. Thank you very much.
Thank you. Okay. Hi, Richard. You've been on the phone for a little while. Thank you so much for holding. I'm sorry for the technical difficulty. Go ahead. Richard, are you there? All right, let's go to our next person. Hold, everyone, please. Let's now go to Shelby. Hi, Shelby,
Yes.
Are you on the line?
Yes.
Hi.
Hi. I do have a question. For the IRS refunds, why can't, once people get them filed, why can't they get their taxes on this time? A lot of people rely on those checks that got sent home and they can't work.
No, they can. Oh, it's a good question. In fact, I'm glad you raised it because it reminded me. It contradicts a little bit of what I just said. Even though tax filing is going to be delayed, you won't have to. It's important for most people to go ahead and file because most people get refunds. So it's important to go ahead and get that filed. And I'm glad you raised it because I meant to say that earlier. Does that help you?
Yeah, but we have been filed. We're on 4 weeks now.
I see. Oh, I see. So if you could get an advance prior to the deadline for filing, I see. Okay,
yeah,
that's a fair comment.
Are like that too.
Well,
they
look, I believe
those checks of work, and when we can't work, it's bad.
I understand. Great point. I'm going to write that one down, and we're going to forward that into Washington so that we can get this considered as part of the negotiation, okay? And it's part of the reason I'm doing this call, because it helps me hear from you as to realities on the ground. Very good point. Thank you so much. I appreciate it. We will bring that up in Washington. Let's now go to John. Hi, John, you there? Hi, John. Okay, we must have lost John. Again, if any of you fell off the line, oh, I'm sorry. I just lost John. Let's now go to Angel. Are you there?
Hi, this is Angel. Can you hear me?
Oh, yes. Hi, Angel. Sorry, I said Angel. Angel, go ahead.
No, that's okay. That's okay. I appreciate that the Families First Coronavirus Response Act has been passed. And while this is a necessary step, it only requires private health insurers to cover testing and most out-of-pocket costs with initial tests. As a constituent, I need to see that this bill requires protection so we will not be seeing surprise costs beyond testing. I'm thinking about my parents, and they're really vulnerable to corona with their age and underlying health concerns, but what will you do to make sure that they don't get hit with tens of thousands in bills if they are positive and need treatment after the test?
Angel, fair question. There is a health section in the Senate bill. I'm not clear as to whether or not it addresses people who have actually been hit by the disease and added expenses they're going to have. Testing is now free. I'll just give you a little bit of a scenario myself. I mentioned earlier on the call, I walked through a series of tests because I was ill last week. We didn't go to coronavirus because I had an upper respiratory illness as it was identified. But that test was not readily available through the normal channels, so that we had to go through a hospital. But given the urgency of getting it cleared up, given how much exposure I have to others who have potentially had the disease, as well as how much exposure I have to the public to protect everyone else, we thought it necessary to get that test going, so we sent it through a hospital. I commented to my doctor, I said, yeah, the next fight is going to be over this surprise bill, because we had to do it through an urgent manner. Look, I hear you. That is a great question. We're going to put that on the list. I have my staff listening as well. Alan, do you or Tom, do you have any particular insight on that issue as to how it may be handled in the Senate bill thus far? Alan or Tom?
Sir, no, this is Tom. I think we'll have to get back to the constituent.
Okay. It's a fair question, but again, obviously, normal insurance rules may apply here, just like any other sickness, through normal copays and such, but I need to check that just to make sure there aren't additional provisions here to protect Americans who have been victimized by this, okay? So thank you very much for the question. Let's now go to Herb. Are you here? Hi, Herb. Are you on the line?
Hello, Congressman?
Yes, go ahead.
Sorry, I'm not sure where Herb came from. My name is Dexter Schroet.
Dexter, I'm sorry. Maybe Herb had the number before you. Sorry about that.
Yeah, must have. That's okay. This is actually really opportune, and I thank you for hosting this teleconference town hall. I am the Vice President of Advocacy and Regulation for the Nebraska Medical Association. We represent Nebraska's physicians. And one urgent request we have for you and the members of Congress is, as healthcare services, routine services are being pushed to telehealth, there is a reimbursement crisis happening because most health insurers...
Dexter, can I interrupt? Hey, Dexter, I'm sorry to interrupt you.
Yes, sir.
I get it. I've had that conversation this morning with a specialty surgeon. You know what's happened at the national level, that telehealth is supposed to now be reimbursed and reimbursed quickly, I believe at the same rates for in-person business. Is that correct? Do you have that understanding?
I do not. Only CMS has announced changes to their telehealth policies.
Okay.
Here at the state level, we are not seeing any movement by the health insurers to reimburse at equivalent rates as in-person services. We do understand that some health insurers have expanded their scope of coverage. However, the reimbursement needs to be there because as physicians transition to this type of care, that loss in revenue between their typical in-person visits and telehealth visits is going to shutter our clinics here in Nebraska.
No, I get it. It's devastating, and it's one of the things that we can do. Actually, I believe there is some address of this in the working Senate bill at the moment, but I'm not sure of the specifics. But what I'd like you to do, Dexter, if you would, I'd like you to put the basic comment in a one-paragraph email to me and send it to me right now, and I'm going to move that to the governor's office. So I did have a brief conversation with the governor this morning on that. We've also had a brief conversation, staff to staff, with private insurers. There is a rapid movement to scaling up telehealth. I think this is very important, but you're exactly right. It has to be made realistic. You cannot ask the medical system to basically contribute to where they're already exhausting themselves and shifting their business models, but they need to be reimbursed adequately to be able to stay in business. So I hear you. It's a very important consideration. Can you do that for me, please, sir?
I can, sir. Thank you very much.
Okay, thank you. This is very important. I'm glad you raised it. Let's go now to Cheryl. Are you on the phone? Hi, Cheryl.
Yes, mine is a simple question. I am just wondering what is being done, if anything, about the raising of prices of products that citizens need from the stores, and also what is being done to make sure that we continue to receive what is necessary to keep us safe. I do have another question to add to that. Talking about the testing, it seems to me like we should, if we have symptoms, assume that we have the coronavirus and just go ahead and quarantine ourselves and whoever is in our home at the time. Is that being suggested to people rather than having people run out and try and get tested?
It depends on the circumstance. Basically, if you have a fever and shortness of breath, those are two primary indicators that you would need to seek help. If it's basics of a normal cold or something, I don't want to get too much into. I would just seek telephone help and some guidance from your basic primary care doctor or a healthcare system that's available to you, even the public health system, and they'll give you guidance on that. Anything that you can do to be prudent, though, in terms of basic hygiene, washing hands, staying away from people if you're sick, is obviously very reasonable. You said it very well. But if some more severe symptoms are developing or you're worried about it, just go ahead and call your doctor or the local health system, and they'll give you guidance on whether or not you need to come in. But I do think that distancing policy is actually very wise. To your first question, I had a good conversation yesterday with the Secretary of Agriculture. Our food supplies are in really good shape. There's been no disruptions, either in terms of processing or logistics or at the retail level. Look, by the way, the other night I was in one of our local major grocery stores, and it was late, so there weren't a lot of people there. I went very late, and all the stuff is stacked up in the aisles because they can't replace it fast enough. But apparently actually food stocks in restaurants are too high because we're anticipating further demand. Our restaurants that have been able to stay open, by the way, through drive-thrus, it's just been heroic what they've been able to try to do. So anybody that's in that industry, thank you so much. I really appreciate it. If you see any hint, though, of some type of price gouging, you need to report it. Bring it back to my attention. I don't think that's going on. We're in a national crisis. This is Nebraska. Nebraskans are doing the right thing. But if you do see any hint of that, please let me know if you would. Thank you so much. Great question. I appreciate it.
Thank you.
Yes. Let's now go to Norman. Norman, you on the line?
Yes, this is his wife, Judy.
Hi, Judy.
And hi, Jeff. Is there a chance that you've talked to who is actually ordering the mask, gown, and test kits for the state? When can we expect them to get in? And can I have a date? Because we're getting, they're saying that they're pushing up all these, they're getting into production for the masks and gowns and test kits, but we're not seeing that here in Nebraska. So That's one of my questions. My other question is, what are we doing with the price gougers? Like Jared Kushner and his group that had waited
Let's hold on that. Let's hold on that. Look, let me answer your first question because I think it's very relevant. I do not have a case-by-case scenario analysis of what the situation is on supplies locally. I have instructed any medical provider that if they want to contact me, we can put them in the right touch with the national people who are in charge of supplies and try to solve that situation. I think we're doing fine. There may be spotty shortages. I did have a conversation with the rural medical providers recently. I noticed some heroic people in the construction industry actually move their respirators and masks, which can suffice for the medical conditions, to Bryan Hospital. I saw a report on that. The person from the FDA is on the line, the Food and Drug Administration. Do you have any further comment on that?
Hi, yes, thank you for that question. My understanding is that the health department is going to coordinate with the assistant secretary for preparedness and response and distribute directly with the state health department.
Do you have a timeline on that?
I do not. Unfortunately, that is a different portion, but I think we can work with your staff to get an answer on the timeline.
Again, I think that we are holding our own in Nebraska. Some spotty shortages here and there, particularly on swabs in individual medical clinics. If anybody sees a problem like this and thinks that I can help, please let me know, and we will contact federal authorities to work through our local health department. Thank you very much. Let's now go to, hi, Kyle, are you on the line?
Yes, sir, I am. How are you doing?
Hi, I'm trying to hang in there. How's it going for you?
Well, as we all are.
Yes, sir.
And I don't really want to say where I work or anything like that, but I am.
That's fine.
And I am concerned of the shortage of PPE, and I heard you just comment that we're holding our own. I don't agree with that. I think we are being told that we have to reuse some disposable PPE items. And I guess my concern comes from we're only like 5 or 6 years removed from the Ebola scare. And I just don't understand why we're having this shortage. We should have learned our lesson during the Ebola scare when we were facing a shortage of PPE. And so for the guys with the Drug and Food Administration, if there's anybody from the CDC, why didn't we purchase more of this PPE and have an international stockpile? I guess that's my question.
Well, thank you, Kyle, for the concern. Look, there are going to be a lot of lessons learned from this after we're done, after we turn the corner. Right now, we're in urgent emergency status. What I'm trying to do at the federal level is make sure resources are moved to ensure that our health system protects you and that we're protecting economic well-being. When we've encountered spotty shortages here locally, we've actually tried and I think gotten movement from the federal government to move supplies into specific situations. So I'm dealing at two levels right now. One is, again, the larger construct of protecting health and protecting particularly small business and the economic well-being, and then trying to deal with individual cases. Your question is correct and good, and I can almost assure you there are going to be some hard lessons learned from this after we're done. The priority right now is to move help as quickly as we can. During the Ebola crisis, by the way, as a little side note, and I said this earlier in the call, our dependency on China needs to end. That is one of the lessons that some of us have been sounding this alarm way before this epidemic, including me, but it needs to end. And that message needs to be loud and clear to the pharmaceutical industry and medical supply industry. Just like military hardware and supplies, our medical equipment needs to be made in America. That is my decided perspective. And there's going to be, at least from me, considered movement in this regard in Congress. I think there's going to be a lot of things that are going to be restructured after this epidemic to make our country stronger, to give us a better sense of national solidarity, and quit this overdependence on multinational corporations who are detached from the reality of being morally responsible for things like this. So I appreciate the question. Thank you very much. Let's now go to Andrew on the line.
Yeah.
Hi, Andrew. Are you there? Andrew, are you there?
Did my grandson tell you to call me?
I'm sorry. I don't. Who's on the line?
He didn't tell you to call me.
I'm sorry. Thank you. Let's now go to Stanley.
Hello?
Hi, yes. Who's on the line? Your first name?
Ramona.
Hi, Ramona. Yes, this is Congressman Fortenberry. What's your question?
Oh, you're awesome. I just have a little concern. First of all, my granddaughter and I are sitting here. She has Down syndrome. I am an older person, not real old, but older. And I have lung cancer, so we're both in that group, to be careful.
Oh, God bless you. Okay.
My question is, we had it come up here in Lincoln that a young lady had been here to play basketball, and she'd been here like March 4th. And then she had stayed with family members. And then we also had another young man that had played ball here, and then he ended up, both of them have ended up with the coronavirus.
Yes.
My question is there a way to, once people are found out that they have this, to track and trace better where all the places they have been, make it public, so that people like us are not going in those places?
Oh, yes, Ramona. This is such a hard question. It's a great question, and it's a hard question. So there's two levels of response. One is, generally you're right, and this is part of the reason that, for instance, the state basketball tournament was canceled, and then other large events began to be canceled. In order to enact this social distancing policy, and while we do not have the fullness of the handle on how widespread this disease is, and while we do not have the fullness of testing available out there yet, even though it's potentially coming in a few days for those who are in need, there is a balance here between completely shutting ourselves down, which could potentially do more harm as we're not getting, again, the necessary supplies and the necessary means to people to basically function, versus controlling the disease. So hopefully the policies that we've enacted quickly here, and that everybody, for the most part, is being properly sensitive to, with social distancing, and if they feel badly, checking in with their doctor, and if they're testing positive, being quarantined, will create enough time for our medical establishment to catch up to the needs. Then we'll see how many people really have this. The incidences of cases will diminish. Our medical establishment will be able to take care of those who are most severely in need. And I do recognize that you are in a higher risk category, both you and your granddaughter. So it's good that you're there, sequestered or a bit isolated from other people. And then if we can move the economic help quick enough, we can keep the necessary small businesses open to get past this problem. So it's going to take us a little while. There's a thing called negative economic multipliers. In other words, we're always talking about economic growth and stimulus and all these positive things in business and government policy. Right now, we're in a policy of economic shrinkage. As people close, the ripple effects of that affect people's ability to pay for their other services, and so they're cutting back. So our intention is to, again, create the policies for social isolation, which you're doing properly, get help to the medical establishment, and you're hearing some of the good questions asked by people in the medical establishment today because they're exhausting themselves trying to help. And then third, get help directly to people and the small businesses who are vital to keeping us running. So it's a tough balance there. We've not gotten to the point where we're tracking anybody's particular movement, but people who have the disease are supposed to be quarantined. And again, hopefully this works. We've seen it work in South Korea. They have what's called flatten their curve. The number of incidences has gone down. I'm really hopeful that in a short period of time we're going to see the same thing in the United States. But I will tell you in the next few days, the amount of disease is going to spike. And the reason is we're going to have more tests and we're going to find out more people have it. But again, combined with the social isolation, we're going to see this fall off hopefully quickly and take care of those in need and get past this. So that's the perspective I can give you, but it's just a tough call keeping those two things in balance. Thank you very much, though, for your concern. Let's now go to Joyce. Are you on the line?
Yes.
Hi. Yes, go ahead.
Everything is for the children. Now, what about the elderly people? We're supposed to be quarantined at home. We can't go any place to get anything. Why can't they do something for the elderly people?
Well, a couple of things here, and I'm going to turn to the director of a social service agency who's on the phone because I think it might be a good time for him to speak. But a couple of things. One is we're going to try to move funds directly to people in need quickly. So if you are in need, that's going to come. If you have a food shortage, we're actually beefing up the amount of eligibility available to seniors. There's going to be some delays in tax liability and other things that should help. If you yourself are in any kind of danger or anybody else who is vulnerable or elderly is any kind of danger, I have an old friend on the line. In fact, I used to be on the board of directors before I was in politics of this agency myself. It's called Catholic Social Services, one of the lead agencies in Lincoln helping people who are in need. Father Fulton, are you on the line still? Would you like to give Joyce some information?
Of course. Thank you very much, Congressman, for having me on. And Joyce, look, I know there are a lot of people out there needing help, but the good thing is there's a lot of people willing to help. So Catholic Social Services is really kind of built, and a lot of agencies throughout the state are built to help you. My parents themselves are both elderly and compromised, and I'm going to give you my phone number, my direct phone number, if you don't mind. And if you need some kind of groceries or need someone to shop for you, we'll be happy to help you. And if anyone else is on the line too, feel free to take this phone number down, and we will.
Hey, Father, I need to let you know there are thousands of people on this call. That is very generous of you to do. But I think maybe the better consideration right now would be the input of there was a gathering of 100 social service agencies yesterday.
Sure.
And why don't we have a little bit of a report, and if there is a single number that's being coordinated between agencies, because somebody might have a better relationship with Lutheran Family Services or people for the people Center for People in Need or other agencies like. So it's beautiful that you want to do that, and if you want to go ahead and do that, that's great. But let people come to me, and if they need to go to you, I think that's the better way to do it.
You bet. There are plenty of agencies out there, like the Congressman said, that are doing pre-packed groceries and delivering them to people. Also food distributions locally on site, diapers and baby formula, personal hygiene, and then also emergency cash assistance, the understanding that people are going to unemployment and need help with rent and utilities. Also, I'll put a plug out there. There's many agencies out there that are equipped for counseling. There's a lot of fear and anxiety, obviously, a lot of depression, but there's people out there willing to give help. I'll give you this centralized phone number, 402-327-6223. 402-327-6223. 327-6223. If you call that number, if you have to leave a message, that's okay. We'll get you to somebody that can help you.
Beautifully said. Thank you so much, Father Fulton. I appreciate that. And again, this agency was on the phone with 100 other agencies yesterday in a coordinated call by I believe the Nebraska Center for Families and Children, part of the HHS at the state level. So there's a lot of coordination going on, Joyce. So I'm glad you raised the question. So again, the federal response is going to try to move direct assistance to people. We've beefed up food banks and food assistance. We've beefed up unemployment assistance. We're trying to move funds directly to small businesses so they can stay open. That's the general response going on here. But it's a great question, and thanks so much for the input, Father. Let's now go to Nicole. Hi, are you on the line? Hi, Nicole.
Yes, this is Nicole.
Hi.
Hi. I visited a friend who had no symptoms when I visited her, and then the next day she began showing symptoms. She had body aches, sore throat, sinus pressure, cough, and headaches, but no fever, but she felt feverish. She went to the doctor, and they tested her for strep, which was negative. She was not tested for the flu, but she was diagnosed with the flu and sent home with Tamiflu. So then 4 days later, I got the same symptoms, and I called UNMC, the coronavirus line, and they said since I didn't travel and I wasn't having a hard time breathing, I couldn't be tested, even though those were a lot of the cough that I had, the sinus pressure and sore throat were a lot of the same symptoms that the coronavirus has. And then I saw on the news that a large percentage do not have any symptoms at all. And so I'm just wondering, how can the numbers have any legitimacy if we're not testing people who have symptoms?
Nicole, thank you for your question. Let's talk to it on three levels of response. One is, I'm glad you brought up UNMC, University of Nebraska Med Center, which has a website which, as I understand it, has good information on this that's more locally oriented. So I would assume you can go there. Can everyone still hear me? Am I on the line? Yes? Okay. I'm sorry we've been having some technical difficulties, and we've got a lot of people in the queue, and I want to try to get as many questions as we can before we have to end. I'd also like your opinion as to whether or not this conversation and dialogue is helpful to you. We want to be here. My own staff is in isolation, and we're trying to telework as best we can, and we have a relatively small staff, but I want to be here for you. So that we can get you the potential answers that you need on the federal response. That's primarily my job, but also to serve you and your particular needs. Nicole, I mean, frankly, I'd check back with the doctor, given what you said, and maybe press them that you've got maybe more advanced systems and you may have been exposed to this. I'd do that on a personal level. Third is, regarding the broader issue is, this is a triage moment. The supplies simply weren't there. You saw what has happened in China and Italy. Italy has been overrun by this virus. The good thing is we don't seem to be heading in Italy's direction because of the quick response at the federal level to limit travel, to cut off travel from China, cut off travel from Europe. There's a cessation of people moving into the country at the border. And then the social distancing policies that have taken hold. So we're hopeful to turn the corner quickly, and this will hopefully align with more testing becoming available so that it is not rationed as readily as it has been. I think there has to be prudence around this right now because, again, people who are clearly showing symptoms based upon quick reviews are going to the front of the line versus others who have more flu-like symptoms. It frankly surprises me you weren't tested for the flu. Again, I'd go back to the medical provider and try again. But thank you very much for your question. Let's now go to Donna. Hi, are you on the line?
Yes, I am. I'm going back to Frank and the supplement check coming out. Just like Frank, I do not make enough Social Security. I haven't filed in the last 5 years.
I see.
And I know there's more of us out there. Is there anything
let me
that...
ask, can I ask you a personal question?
Yes.
Would this money that's going to come your way, again, it's still fluent, are the people who have tax liability. That was the initial response, the money that was going to come their way. and it was under consideration that people who do not have tax liability, why are they being left out? So that is a policy question being debated right now. Would this be of personal assistance to you of some significance if you got a check for $1,200 right now?
Oh, yes, because
Okay.
I have to live with relatives, and they routinely have to transfer money to me so that I can live, that I can go grocery shopping. I haven't bought new clothes in 2 years because I can't afford it. So that would be a godsend.
Yes, ma'am. This is, thank you. I'm sorry to ask you a personal question. I can hear the emotion in your own response. You're absolutely right.
Anybody?
You're absolutely right. You're absolutely right. And look, I have staff on Washington D.C. who's again telecommuting, who are really working hard to be a part of the negotiations. And I have key people from key committees and key agencies on the phone as well. They're all hearing what you're just saying. And for my own staff, I urge you, let's quickly get this teed up to the leadership who is negotiating this bill very quickly. I think this is a critical consideration, that it's not just about those who owe taxes, it's about those who are in need, and maybe the tax liability isn't the right framework. It's a good one, but it's not the full one by which we need to consider moving help to people. I think, to assure you, Donna, I think that's absolutely under consideration right now, but we are going to actually press on this issue as best we can. So thank you for your heartfelt comments. I really appreciate it. Amanda, are you there?
Yes, I'm here.
Hi. Did you have a question for me? Yes, this is Jeff Fortenberry. Thanks for holding.
Hi, Jeff. Thanks for taking my call. I'm going
Sure.
to say that I speak for many in-home child care providers in the state of Nebraska. 60% are in-home, and we are so scared because we cannot file unemployment clearly. But I'm also worried for my families that are on Title 20 because with the shortage of providers already that do not take Title 20, I have one parent for sure who is able to work from home and still having to bring her child to me on every day because otherwise she's scared that she will lose her spot in my care with the shortage of people willing to take an infant plus another child. And she is terrified in having to bring her children to me with other children that I do have in my care, which some have chosen to work from home and still pay. So there's two sides of it that are terrified. You know, the state, I contacted my licensing inspector. I also contacted my
Okay. Hey, Amanda, if I could interrupt you, I'm sorry to interrupt you. Let me go back, walk through that scenario a little bit slower so that I can fully understand what you just said, because I think it's very important, and I think a lot of people may be in this particular situation. So you have people who are providing in-home care while they are teleworking, and they're appropriately cautious or afraid to bring people to your child care. Is that the basics of the issue?
Some of it's that obviously I can't file unemployment, so I'm having to keep my doors open as much as I can to help those in need as well. But also, yes, those Title 20 people. I have one who's able to work from home to keep her job, but she's still in that low income bracket that she qualifies for Title 20, but being told by my, I guess her social worker that if she is not bringing her kids, you know, I cannot charge her or I cannot charge the state for that spot. So if I were to fill it, where would she go? I mean, there's so much of a shortage right now.
Okay, that's a great, Amanda, this is a great, another subtle subchapter point of the dynamics that are out there. I'd like you to, if you would do me a favor, put this in a one-paragraph summary in an email so I can forward it to the state, because it's a very appropriate consideration what you're asking me about. Can you do that for me, please? And then just go on my website, fortenberry.house.gov. We'll see it almost immediately. My staff's on the line. They'll flag it. And we're going to put together a list of things not only that goes to national providers, but also goes to state, okay? Thank you. Sure.
I do have one more question. Obviously, you were talking about supply shortages. Clearly, if we're at home working, and some of us have husbands who are at work too, we are not able to go out until the evening where things are gone, but yet we're still providing care to the community. And the sanitizing products is where I am at a kind of a panic because I'm trying my best to do what I can to make sure nobody in my care gets sick, but Lysol spray, hand sanitizer, I understand, and I have compromised families that have compromised relatives, so they can't just take their kids somewhere else. And I'm going, I don't know what to do. I can't even get supplies anywhere.
Yes, I'm sorry. It goes beyond basic medical supplies, in which there's some spottiness out there. Look, regarding the basic stuff in terms of food and sustenance, we're in good shape. I had this conversation with the Secretary of Agriculture yesterday at the highest level of assurance that our food supplies are sound and there's been no disruption. We're a little bit concerned about, in the processing industry, if somebody would get sick, how we handle that. But as of now, there is no disruption, and in fact, we've got a strong backlog, and logistics are still in place. Now, with the specifics of Clorox wipes or sanitizing wipes and hand sanitizers, I've heard that myself, so we're all going to have to stretch here until it catches up. So, listen, we're in a national situation that is just urgent. I know everybody understands that, and you're doing everything you can, not only to care for yourself and to be smart about things, but also caring for your neighbor. In fact, I had someone suggest to me that if you think of someone right now, if they just come to your mind and your conscience, maybe the best thing to do would be to give them a call, because some of us are worried that, again, there are elderly who are isolated out there, and even if they have substantive help through various agencies, just giving them a little friendly virtual hug, if you will, I think is an important part of being in solidarity as a community here. So many of you are already doing that. You don't need to hear that from an elected figure, but somebody told me that would be a good thing to say, and I do. So thank you guys for doing it. Look, I would like, I asked a question of you all earlier. I'm going to make an assumption that these conversations are helpful to you all. We're going to try to do them regularly. We're going to try to do them shortly with the small business community so I can give them specifics of what is being deliberated about how they can potentially get money to keep their doors open and pay payroll. So if you have any thoughts on how this is coming across or how I can improve it, please let me know. Roderick, are you there?
Yes, I am.
Hi, go ahead.
Hi. Okay, my question is, okay, I haven't been able to file even work since like 2016. I'm on disability. Trying for disability. I'm wondering, is disability gonna shorten the time it takes to get it? I've been applying for years. It's nothing but red tape, and I haven't been able to work. I've got a 1 in a million type of cancer. I have lung disease, and I'm still fighting to get disability. And it seems to take everybody 3-4 years and 3-4 times to apply, and it just takes forever.
Okay, Roderick, thank you for the question. What I'm going to do is I'm going to ask you to email me with the specifics. If you have email, go ahead and email me with the specifics of your case. We have people who actually work on these things in my office. We're a small staff. This is the United States Congressional Office, but we've got a relatively small staff. And while I have you all on the line, I want to commend my staff because they're working very aggressively, exhaustively to do two things: to make sure that we're trying to get the policy right in Washington and to serve you here. We've got a lot of support systems, social support systems. We also have state government and local government actively involved in help. But the disability question is one that we can look into for you in normal times. We'd have somebody right on this, but we're stretched very thin, as is everybody else, dealing with the emergency of coronavirus. But if you do that for me, Roderick, we'll be happy to look into this and see if there can't be some additional consideration of your case. We do that for others. Sometimes we can resolve it, sometimes we can't. But I'd invite you to send me an email in this regard. If you don't have email, call back and just leave me a message, and we're going to get to that, okay? But I appreciate it. Listen, everyone, if you didn't get a chance to ask a question, press 1 on your phone and leave me a message, and we'll review that. If it's something urgent, we're going to get right back to you. If it's not urgent, I'm going to review all of these messages, and we'll take them as they come. Again, I'm very grateful for your willingness to spend time with me on the phone today. I'm sorry I didn't get to every question. I'm getting a bit of good feedback that these are helpful to you all. If it is, please let me know by email, and I'd be grateful for the feedback and input as well. hang in there, and everyone, again, I'm hopeful that we look back at this very hard and time of great national suffering with, frankly, after we turned the corner, some fondness in which neighbor came to help neighbor, and we all rekindled the spirit of national solidarity. So thank you all so much, and again, we're here if you can email me with your specific questions. Thank you.